Okay, we're back in the toilet for want of a better place to be. The lighting is quite good in here. I'm at Woodlands Poppy Ward Mental Health Facility in Ipswich, provided by the NHS. I've been brought in here because of a dispute over council tax, which I attended Mid-Suffolk District Council officers, and they turned round and reported me to social services. Social services then done a doorstep challenge, turning up with the police at my house, putting the boot in the door, and an amp and two doctors. When they see you, they decide that you need to go to the funny farm, and they'd call an emergency ambulance, strap you in and take you off. Once you're in here, the doctors have a self-righteous attitude that they are helping you when they are only helping themselves to a lot of money. This facility costs £500 per patient per day, so that's a lot of money. You have an opportunity to put your case to a tribunal, but you have to wait. My tribunal is on Monday, so I'll have been here for 12 days since the 16th of June. That's going to cost £5,500 just for me to stay here waiting for a tribunal. Dr. Jenkins, I'll call him Dr. Death because Norfolk and Suffolk Mental Health have had an awful lot of patients die of what they called unexpected deaths. You can look it up online. They had sent 333 inspectors from the Quality Care Commission, and they carried out quite a few inspections. Obviously, when they inject patients with drugs, which they're obsessed, Dr. Jenkins is obsessed with drugs. They offer no other remedies here, not even vitamins, not even a vitamin infusion that could help my chronic fatigue syndrome, which is merely that you're tired, you sleep. You don't want to be disturbed, and this place is constant disruptions with fire alarms, other patients' despair, noise outside, the birds in the morning, and their hourly checks. The Dr. Jenkins wishes to prescribe a drug called risperidone, which has a number of side effects, such as it can induce death, but also most patients who have taken it have reported some kind of side effects, which is slow mental ability or cognitive ability. It slows your thinking down. In the mornings when you wake up after being injected with risperidone, it's hard to wash, shave or carry out basic tasks. It can take several hours before you're actually able to think. People have reported that when you ask questions, it takes a long time for your brain to come up with the answer. Internally within your brain, it seems to be that patients report that they're actually asking, how can I answer this question? It reduces your mental capacity by about 50%, so your IQ is reduced. Obviously, me being an engineer, it's rather concerning that Dr. Jenkins will jump to using a drug that could affect me for the rest of my life. I will not consent to this drug. However, with Dr. Jenkins, with his pious attitude, is that they, under the Mental Health Act, can inject you with drugs, and they have held patients down.